As you know, the American Society of Hematology has initiated a multifaceted program in order to address the burden of sickle cell disease here in the United States as well as around the world. Now, one of the great advances here is that they have managed to reduce mortality dramatically in many of these kids, but screening is really the issue that starts the whole thing, and that is the Achilles heel. So we are here to talk about the implementation of a sickle cell disease screening initiative in Uganda, and I am with Dr. Erik Serrao, who is a PhD, the Director of Business and Product Development at Silver Lakes Research Corporation in Azusa, and we're here to talk about HemoTypeSC, which is an assay, correct?
Yes, sir. It's a new rapid test for sickle cell disease, and we designed this at Silver Lake Research specifically for resource-constrained parts of the world with the highest sickle cell disease prevalence. So not necessarily high resource, but low resource regions. And so HemoTypeSC is a point-of-care test. It delivers results for sickle cell disease in 10 minutes from just a droplet of blood. And the price point for the test to the end user in Africa is less than $2. So we're really excited about the test and the impact it can make in enabling newborn screening initiatives.
Until now, what's been the dilemma making screening so difficult?
Well, in more high-resource regions, children are screened at birth most of the time with large laboratory machines. So this is kind of the standard in the US and Canada and Europe. And as you mentioned, this has really reduced the mortality of sickle cell disease. But in resource-constrained areas like sub-Saharan Africa, central India, these machines are not really amenable to widespread use for various reasons. It requires a significant upfront investment to buy the machine, to maintain the machine, and importantly, these machines require the blood sample to be shipped away from the point of care and the results to be shipped back to the point of care. So this results in a large loss to follow-up. Sometimes children are actually diagnosed by these machines and never get their results and die anyway. So HemoTypeSC can really stem that problem by delivering the results cheaply right at the point of care.
Describe where and how this study was done, because you had like 1,000 kids who were prospectively recruited into this thing.
Right. So we established a collaboration with the Great Sickle Cell Association of Uganda, led by Ruth Nankanja. And this is in a region of southeastern Uganda where 1 in 5 childhood deaths are due to sickle cell disease. So it's a major problem. In coordination with this association, we recruited 1,000 patients aged 1 month to 5 years of age. We screened them all with HemoTypeSC and compared the results to the gold standard method at that laboratory. And what we found was that at the end of the day, HemoTypeSC delivered 1,000 out of 1,000 correct results for 100% overall accuracy.
That's pretty impressive.
We're very excited about the data, and our ground team's currently using the product as their standard of diagnosis moving forward.
That's what I was just going to say, because in your abstract you note that this approach could save the lives of millions of children over the coming decades.
Right, so it's important to note that newborn screening needs to be combined with immediate treatment, prophylaxis, and counseling. That entire equation equals reduced mortality. So the treatment, the prophylaxis, the counseling exists and can be enabled in Africa. The problem, the missing link, is the diagnosis. So HemoTypeSC can really provide the groundwork such that the treatment and counseling can be accomplished and the mortality can then reduce in those countries.
So what's next?
Next is gaining regulatory approval for this product. We've already got our registration applications submitted in many different African countries and in India. So as soon as this product is officially approved by the ministries of health in these countries, then we can start rolling it out on a widespread fashion.
Congratulations. This is very optimistic news.
Thank you. We're excited, and we've had great help from our African colleagues, and we're looking forward to bringing this to Africa.